Happy Monday, everybody. This is the Anchorage Emergency Operations Center update for the 3rd of May. That's right, folks. It is May. CIOs and liaisons, everybody's been doing a really good job to get the word out about our vaccine week that is currently underway, and we'll hear more about that later. Again, if you need any of these sheets, please email public information or others to get this flyer so you can see this up close. Go ahead and do AJ for the situation report, please.
In Anchorage, there was 38 new cases, 0 deaths. So for the 213 RRs, there have been a total of 1,742 that have been filled or satisfied. That is 3 since the last report, and there are 22 open or working. All right, for mass care, for congregate, there are 400 clients. That's 3 since the last report. 316 for non-congregate, 5 since the last report, and that's a total of 317. Was +8 since the last report. Since May 1st, there have been 405 samples collected. Unofficially, there were 550 vaccines given this weekend. We are still waiting for those current numbers to come in, and once they do, they will be distributed.
Thanks, AJ. Weather.
Good morning, everyone. It's Michael Cutts with the National Weather Service out in Sand Lake. Basically looking at very few sunny breaks over the next several days, Thursday being the best day for some sunshine. Going to have some sprinkles tomorrow, not enough to knock the dust down. And Friday begins an extended period where there's chances of rainfall all the way through the rest of next weekend. Some breezy conditions along Turnagain Arm for today and tomorrow. And that concludes my briefing. Any questions?
Thank you so much, Weather. Operation.
Hey, good morning. Joe Calavig, Operations Section Chief. For our mass care branch, Q&I has 9 projected discharges through Wednesday and will discharge 1 today. The warming tent had 40 people over the last 24-hour period. With our public health branch, visit healthcare testing had an increase of 3.85 over the previous week's sample collections, and the 7-day rolling positivity rate average is 2.05% as of April 29th. The 14-day average reproductivity rate is 0.864, which is trending down. And the 14-day average case rate is 14.03 per 100,000 people. For pop-up testing this week, we have Muldoon Elementary School on May 8th from 8 a.m. to 7 p.m. With our medical countermeasures branch, some of the vaccine updates we had good turnout over the weekend for some of our drive-up pop-up clinics for vaccine week. This one at Midtown Mall. Those typically run from 6 p.m. to midnight, and they gave 131 doses over the 2 nights. Though we did have low vaccination numbers for the May 1st Northwind Mall event at only 15 doses, but that's only the 3rd Saturday that site's been operating, so we hope to continue to see that site grow. Through the Conquer COVID initiative, we have raffle boxes and signs that have been delivered to all the locations. With Visit Healthcare, we're working our contract amendment for mobile teams, and we're going to finalize that update with Visit Healthcare COB today. Unclear on if they're going to be able to deal with the user agreements with pop-up sites, and so we're going to table that for now and continue moving forward. Our process for finding new locations for mobile teams and pop-up candidates remains fairly time-consuming, so we're working to shift that scheduling logistics to the providers to free up some flexibility in how we can reach more people. Next slide, please. And so for Vaccine Week, granted, it's always a good time to get a vaccination, but Vaccine Week is probably the best time to get a vaccination. This is a little bit of an eye chart if you're looking on a small screen. But the takeaway here is we have a lot of different locations throughout this week, as you can see in this chart. The starred ones denote events specifically designed for Vaccine Week. So just spread the word that there's a lot of locations, and I'll post it in the chat. You can find all these locations on anchoragecovidvaccine.org. Thank you, end of report.
Thank you, Joe. Logistics.
Hey, good morning. It's Scott Carpenter, the Logistics Section Chief, reporting out at the EOC. Going to sound like a broken record today. Nothing's really changed from the last time I reported out, but we'll continue to provide support for the summer shelters, the additional wraparound services, as well as planning the Fairview Rec Center and warming tent closures and getting everything back to where it needs to go. Under medical countermeasures, we continue to support the vaccine week efforts, as well as additional vaccination sites. And catch-all for the EOC and AHD, we continue to work with the transition planning, which includes staffing, and also working on the Northway Association events to ensure that they're covered as needed. Pending any questions, that's logistics.
Thanks, Scott. Finance.
Good morning. This is Carrie Wiedeker, EOC Finance Section Chief reporting. Today, the EOC has encumbered $20,925,858. Our actual spent to date is $49,401,717 for a total of $70,327,575. Please continue submitting any invoices and supporting documentation to eocinvoices@anchorageak.gov. The Office of Management does continue to seek cost recovery by way of FEMA public assistance. For any information related to that, please contact Aaron Zachary. End report.
Thanks, Carrie. Safety.
Good morning. This is Annalisa Roberts reporting out for safety. So this is a wonderful infographic, excuse me, that I found on CDC about choosing safer activities. So it remains relatively safe for fully vaccinated individuals to participate in outdoor activities until they start getting into more crowded outdoor events, such as live performances, parades, or sports events. Indoor, it still remains safest to wear a mask, whether you're vaccinated or not, but it is less safe for unvaccinated individuals to go to a hair salon or crowded or uncrowded indoor shopping centers, riding public transportation. Just keep that in mind when you're choosing activities to do. The CDC can't provide a specific risk level for every activity, so kind of use this as a basis of what you want to do within your group and kind of weigh the risks and what you're going to be doing. But always bring a mask just in case, just to add a little protection. And report.
Thanks, Lisa. Public information.
Hey, good morning, everybody. This is Kel Casey reporting out for the EOC information officers. We're going to continue promoting Vaccine Week activities and sharing social media graphics for clinics of the day. We have earned media from the May 1st event. Approximately 200 to 250 folks cycled through Northway Mall, and that was a trust building exercise there. So the vaccine numbers were low, but part of this process is the wait and see crowd is definitely waiting. And we had those conversations with them. We were able to get a video of testimonials posted same day using our editor in HD, who's working remotely. So that link is in the channel right there on YouTube. We also have that on our OEM YouTube page. We have the location-specific messaging by Northwest Strategies for the rest of the week already in play with particular focus on the Girdwood and Eagle River areas. The flyers and social media graphics are being shared and boosted and being translated as well. We're coordinating interviews for the Humans of Anchorage project. We're messaging and is prepared for the 12 and above crowd, coordinating with the Anchorage School District on that. And our outreach email continues to go out daily with numerous flyers and vaccination appointments, testing information, and all sorts of talking points. End report for PIO.
Thanks, Kale. We had a question that before we run away from you too fast. Cinco de Mayo, has there been any messaging for that for folks to remain safe? Do we have anything running this week? All right. Thanks, Kale. Liaison.
Good morning. This is Celeste Prescott, Liaison Officer for the EOC. I'd like to thank all of our partners who are able to join us. And we'll jump right into the hospitals. Alaska Native Medical Center was unable to join us today, but they are reporting 5 positive cases. 2 of those are in the ICU, 1's on a ventilator, and no PUIs at this time. I believe Sean was able to join us with Alaska Regional Hospital.
Good morning. Alaska Regional Hospital currently has 8 COVID positive inpatients, 3 in the ICU, 2 on vents, and no PUI.
Thanks so much, Sean. All right. And I believe Nikki has been able to join us from Providence, Alaska Medical Center.
Hi, good morning. This is Nikki Holmes from PAMC. Today we have 9 COVID positive patients, 2 in ICU, 1 on a ventilator, and 3 COVID recovered. Thank you.
Thank you. Thank you, Nikki. Thanks for joining us. And I'm not sure anyone was able to get on, but is there anybody with the 673rd Medical Group today?
Yes, good morning. This is Sergeant Perez of the 673rd Medical Group. Reporting out our vaccine numbers. As of Friday, we have administered a total of 15,985 vaccines, 8,703 of those being the first dose, and 7,282 being both doses. Any questions and a report?
Thank you very much, Sergeant Perez. Thanks for joining us. And I believe Kara is on with Mat-Su Regional Medical Center.
Good morning, Kara Cahill with Mat-Su Regional. We currently have 15 positive COVID patients. 7 of those are in the ICU with 6 on ventilators, and we currently have no PUIs. Thank you.
Thank you very much, Kara. And I see a note in there. Sergeant Perez, if you wouldn't mind dropping those numbers into the chat, that would be appreciated.
Thanks, Celeste. Anchorage Health Department.
Good morning, everyone. I must have missed the cutoff for the slide, so I'll make sure that we get that sent out with the health metrics report later today. The overall Anchorage COVID-19 risk level has dropped slightly again this week, but remains in the considerable risk category. The average daily new case counts decreased this week, but remain high. Risk is related to additional factors, also decreased, but remains high due to concerns related to more transmissible variants, vaccine hesitancy, and high case counts in neighboring communities. And all other risk metrics are in the lower risk category. While vaccination coverage continues to increase, as you have heard, hundreds of appointments still remain available. Approximately 57.3% of Anchorage residents age 16 or older have received at least one dose, and 49.7% have completed the series. And these numbers are as of Friday. Despite increasing vaccination coverage, daily new case counts continue to occur at a high level. Case rates are increasing in younger ages, including school-age children, while dropping in the older age groups. So thank you. That is the end of my report.
Thank you, Kelly. And Amanda for command, please.
Hey, good morning, everybody. This is Amanda Loach reporting out for the command. Bob is taking some well-deserved time off this week. I just wanted to focus in really on Vaccine Week, the mission of which is to make sure that everybody that is eligible for a vaccine knows that where they can get those and just has as much information as they need in order to facilitate getting to those vaccines. We do have a lot of events going on, and I was able to attend the vaccine kickoff at Northway Mall, the Vaccine Week kickoff. And it was really a very safe and comfortable, good, positive feeling there. So hopefully our events can keep that feeling going, and just really working with our community members to find that comfortable location and event and time for them to be able to access the information that they need to get to vaccines. So thanks for all the work going into Vaccine Week. As well, the team is looking at moving forward with transition. For those of you that are have been part of the activation in the last year, and those of you that are incident command purists, gurus, and fans, the EOC will be moving from a command and control type posture to a more traditional EOC coordinating posture over the next couple weeks, and we are looking forward to working through that with all of you, and we just really appreciate the support and keeping moving forward with situational awareness and momentum as we start to recover from this event. Thanks a lot, everybody.
Thanks, Amanda. Our next meeting will be, what would that be, the 6th at 10 a.m. Thanks, everybody.